Today, we treat depression, schizophrenia, and other personality disorders with medication, such as antidepressants or counseling. That was not the case before now. Um, we had a different way of treating that in the about 1950s, 1930s. We would lobotomize people. Welcome to Paranormal Playground. We are your hosts, Nick and Leah. This week, we are going to talk about the history of the lobotomy and some famous cases of lobotomies gone wrong.
All right, so today we're going to discuss lobotomy. So, introduced in the 1930s by the American neuroscience Carlisle F. Jacobson
Sorry, I get thirsty.
and John Fulton. They presented results of an experiment involving the frontal lobe ablation in chimpanzees. So, prior to ablation, one of the animals would become agitated when making a correct choice during a memory test experiment. And after the ablation, that agitated behavior was no longer there. Instead, it became very docile. So in 1935, Portuguese neurophysician, can't say my words today,
That's okay.
Antonio Igas Moniz. I don't know if I'm saying it right. It's Moniz. So Moniz or Moniz. I'm going to go with that. Had a similar operation on a human. All right, so we're discussing where this came from. So we've already talked about 3 different doctors. So it was introduced in the 1930s, but it was a highly traumatic brain procedure. And it was seen at the time as this miracle cure for mental illness, typically for like depression, schizophrenia.
So basically, like these, I don't know, people coming out with PTSD from the service or from a traumatic experience, would that probably be something that would have
That could have been, right?
Okay.
Right? Because it was effective at altering behavior.
Okay.
But here's the issue. Lobotomy is psychosurgery or brain surgery and designed to treat a psychological condition, which involves using a sharp tool to sever the neural connections in the frontal lobe. So your frontal lobe is
I do have a little brain here. Where are you referring to?
Frontal lobe. So it's right in the front here, your prefrontal cortex.
Okay.
Little brain. This is a cute little brain. Squishy.
Yes, yeah.
So it would actually sever neurons. But what we know now, excuse me, is that the frontal lobe is a huge contributor to your brain. It's the executive functioning of your brain. It does memories, emotions, problem-solving skills, long-term thinking, language. Sorry.
And her dogs are barking, which is okay. They do that.
They do. Should we pause it?
No, we can keep going. It's fine.
People are walking in.
It happens. We'll just we'll roll with it.
Still barking.
It's fine. That's what happens when you have animals in a house that you record in. So
when you have impairments to the frontal lobes, they're saying that the person became docile. Well, obviously yes, because you've just severed neurons that has to do with their language skills, their reading skills, their ability to feel any emotion. So you're right. I guess it did work.
Yeah.
In a way.
So basically, a lobotomy is a psychosurgery or brain surgery.
Correct.
Designated to treat psychological conditions but they didn't expect the memory loss, the emotions, or problem-solving skills when they did this.
They didn't expect it, but when they saw that it was happening, they saw it as like a success. They're like, look, they're not angry anymore.
Okay.
Or they're not having like temper tantrums, or they don't have these certain rages anymore. Well, of course, because we took out their ability to do so.
So now, we already talked about Moniz in the 1935.
Yeah.
Now, it also says here he received a Nobel Prize
Yep.
Nobel Prize in medicine for inventing this procedure.
Sure.
Um, so in 1936, Freeman was also part of this.
Oh, Dr. Walter Freeman?
Yeah. Um, what kind of lobotomy did he do? Like, there's two different kinds. There's a
Right.
prefrontal and then there's the transorbital.
Right.
Who did what?
So, earlier, it was the drilling holes in either side of the top of the person's head.
And
that was like your lobotomy.
That is the, what form of lobotomy was that? Was that the?
Your prefrontal lobe.
That was the prefrontal.
Correct.
Okay.
So then we got to go to transorbital lobotomy. So transorbital is more of, thank you.
Where was the transorbital in here? When was that invented?
So transorbital, let's go back a little bit here.
Oh, 1945.
Yep.
Okay.
Okay, so in 1945, Freeman modified the procedure and created the transorbital lobotomy, which he could perform quickly without leaving scars. The lobotomy was developed to treat severe mental health conditions and address problems of the overcrowding in psychiatric institutions. So again, we're going back to it's going to fix mental health issues. However, there was a crowding of institutions. But we're not going to go and think a little bit more deeper. I am, at least.
Okay.
Maybe not others.
Okay.
But we were throwing people in institutions for the dumbest reasons.
Right.
And therefore, instead of fixing that reason and calling it overcrowding, we went towards let's see if we can fix this by surgical means and becoming
a lot of these asylums were there was a period where asylums were very common. Right. And they were how they were built, they had more patients than the buildings could allow.
Right.
Or could safely and effectively treat people. Right. So there was a lot of mistreatment in them.
True.
So, I mean, all the way to the Eloise in Michigan, to the Pennhurst.
Mm-hmm.
I mean, even here in Wisconsin, we have mental institutions all over. The ones that, like last week, we talked about Rosemary Kennedy, that she was in.
Correct. Yep.
And I mean, there was also the here in, or where I'm from in Sheboygan, Wisconsin, there was the institution there that they have haunted tours and stuff as well. Yep. So these places are well known to be a hotbed of activity because of the things that happen there.
Right. Yep. And if you want to discuss, like, when we talk about things that happen there, let's think about what a transformal lobotomy actually is. It's like this pick-like instrument, like a long...
Mm-hmm. Like an ice pick.
Yeah, yep. Mm-hmm. And it's forced through the back of the eye sockets and pierces the bone brain that separates the eye socket from the frontal lobe. And then the pick was inserted into the frontal lobe and severing connections in the brain, presumably between the prefrontal cortex and the thalamus. So in 1946, Dr. Freeman performed this procedure for the first time on a patient who was subdued prior to the operation with the electroshock therapy.
Okay.
And he can actually do this procedure in less than 10 minutes. Now, it was used on many patients.
Was the patient put under, or was the patient awake when all this happened? Awake.
Correct.
Okay.
Patient needed to be awake.
That has to be traumatic. And where in the, if you can use my face if you need to, where are they inserting the pick?
All right, so if you insert the pick in the eye corner right here, like where you're crying from.
Like where the nose is?
Yeah. It's crazy.
That does not sound fun.
Yes.
Yeah. So now the effects were highly variable on this. Yeah. So that is a reason it became so controversial. the intention was to, if I'm not wrong here, to reduce agitation, anxiety, and express and excess emotion, right?
Correct.
Okay, so um, did did this improve some patients, or was this
No.
bad for all patients, pretty much?
It was likely bad for, I would say, all of them, unless there are some
Okay,
success stories. I don't know, but the effects were not widely reported in the 1940s,
okay,
and at that time, the long term effects were largely unknown. However, the typical effects were apathy, passivity, lack of inattention, poor ability to concentrate, um, a decreased depth and intensity of emotional response to life
okay,
was lacking. So it
okay.
was definitely turning somebody, and maybe you are fixing some of their issues, but you turned them
But you're changing the person.
completely.
Yeah, so their brain chemistry is how it is. You're changing their brain.
Correct.
Okay,
And actually severing
all
what
right.
should be working.
So, um, from what I found, it also made some people lose their ability to feel emotions and become apathetic. They were
Mm-hmm.
unengaged and unable to concentrate.
Mm-hmm.
They also became chaotic, and a few even died after the procedures, is
Yep.
what I heard.
Yep.
Okay. So now, how common are these? Were these?
Well, Dr. Freeman, who is the one that did the one on Kennedy, Rose Kennedy,
Okay.
he performed and supervised over 3,000 lobotomies in the late 1960s. And the only reason why this practice really started to fall out of favor was the mainstream use of antidepressants and antipsychotics.
Okay. Do antidepressants kind of have these same effects after a lobotomy sometimes, or
I don't know if he actually used any medications after lobotomy, as
okay,
the medications were starting to substitute the need for the
okay,
lobotomy.
that makes sense. Now, also other countries, including Japan, Germany, did follow suit with they did perform these as well. Um, so it wasn't just us.
No, because even when there was that Nobel Prize that was won
Mm-hmm.
by, um, I can't even say his name again, but I'm going to spell it Moniz. So is it
Moez.
Moez?
We'll just go with
Moez?
Moez.
Okay.
Menez or something like that.
A Swiss psychologist also won that same year
Okay.
for this information. However, if we're thinking back to the 1940s into the 60s, how much about the brain did we know versus what we know now?
Okay.
So, can we blame them or fault them for such terrible treatments? I don't,
Okay.
but I also look back at it and go, how much trauma and pain that must have been for the patient.
Okay. Now to wrap up this part of it, what it is
Mm-hmm.
and everything, because we kind of covered a pretty good history of it, I think.
Right.
Um, is this practice still going on in any way, or what is it?
Rarely.
Rarely. Okay.
Rarely. If it is, I don't know for sure, but I do from the articles that I've looked at, it's rarely performed.
Okay.
But I don't know of any cases that you would really perform that these days.
Okay. I did see that it is banned in the United States, though, so
Right,
we no longer um, perform that.
right.
Um, so, um,
But let's kind of talk about cases because I want to know a little bit
yes.
more. Like, was there
And
any pros, cons? Was there any good
so,
cases?
I mean, I found an article,
Okay,
and it has 12 cases, um, high profile cases. I don't know any of the people, but um, apparently they were well known people or well
sure,
known cases. And the first one is Rosemary Kennedy, which we talked about last week,
right.
um, where, but we didn't talk about her outcome really. Uh, she did end up in Wisconsin,
Yep.
where at the asylum at where Beast of Bray Road is near.
Out
And
in
that's where she did live her,
Jefferson County,
yeah, or
St.
Jeffrey,
Coletta.
or yeah, St. Coletta, that's it. Thank you for reminding me. um, it was a little while ago. So, but she did end up, that was the last place she was, and that's where she lived the rest of her life.
Mm-hmm.
And she was wheelchair bound, and she was basically a shell of who she was
Yep.
after that.
Toddler-like.
Yes, very toddler like. Now, the next case I got is a Rose Williams, the older sister of Tennessee Williams.
I don't know who that is.
I don't either.
Okay.
But she was schizophrenic and described by her playwright brother. Oh, he was a writer.
Okay.
He did playwrights. So that as the sweetest, most genuine person he knew. In his memoirs, Williams notes that Rose would go on a date and she would talk with an almost hysterical animation with few young men, and a few young men didn't know how to take it.
Okay.
In 1926, Rose wrote a letter to her grandma describing her depression. I don't know if you want to read that.
I don't know what was the matter with me except that I was so nervous that I couldn't hold the glass to take the medicine in. I stayed in bed all day and had a big dose of chamomile, and I feel better but still weak. I'd finished a music lesson, and Miss Buttle nearly drove me wild. It makes me nervous as a cat.
So that's what she was going through. So by 1943, Rose was beginning to lash out um, in manic episodes, I
Okay.
guess.
Yeah.
Yeah. And agreed to undergo a frontal lobotomy.
Okay.
The surgery seemed to reduce Rose to a nearly cata, cata,
Catatonic.
catatonic, thank you, state. She remained institutionalized.
Yeah.
So this is a bad example of she was at least able to do her to function beforehand. She by the end of this she was unable to function very much.
That's terrible. So that was a bad case.
Yep.
What about this Elias Robbie?
Okay. She's got a nice picture there. She was described as Canada's answer to a renowned Latin singer and dancer.
Okay.
Um, because of her high voltage
Renditions of, was it Tico Tico?
yeah, Tico Tico.
Nice.
I've never heard it. We
Nope.
might have to look that up. Maybe on some of our trips that we have coming for
Right?
ghost hunting, we might have to listen to some of this. And other songs. Her obituary describes her as being an alluring, temperamental woman with magnetic eyes.
I wonder if that, yeah, okay, that sounds like me. I'm just kidding.
Oh, someone's head's inflating here.
A little bit.
A little bit. But that's okay. Um, so she was sent to a mental institution following a car accident that left her mentally scarred. She went into wild mood swings. So Robbie then received an alleged unwanted lobotomy.
Interesting.
After 5 years, she was released and actually credited the lobotomy to her new calm demeanor. I don't
What,
know if that's a success story or not.
it doesn't give more about what the calmness was. Like, what do you mean
Yeah.
calm? As in no personality, just no
Right.
emotion calm, or just calm? Like,
Yeah.
like it worked.
Like it, but it sounds like she was a different person at that point.
Right.
So, now this one just goes by HM. I don't understand that.
Not like HHM or
No,
no,
not
no,
like H Holmes.
no, no.
No.
Okay, okay. All right, so just HM.
Yeah, just HM.
Okay.
So I don't know if you want to review
So
this
he
one.
was only known by the initials of HM and was hit by a cyclist and cracked his skull. For that
Ooh.
injury, he began suffering seizures and lasted around 40 seconds, that lasted for 40 seconds at a time. So he sought out a physician named Dr. Scoville, a man who was experiencing or experimenting with the fractional lobotomies, which is estimated to be less tissue and supposedly allow patients to keep their
So
original
so
personalities.
they go less. They don't go as deep.
Right, less tissue, so we're not going to cut as much tissue. They're still going to sever some of the neurons.
Okay.
So on September 1st of 1953, there was a hand crank and a drill saw used from the local hardware store to remove the bottle caps of worst bone from above each one of his eyes. He then removed a few key parts of the brain. After the surgery, HM only suffered about 2 seizures a year, which was a vast improvement, and his IQ jumped from 104 to 117, but he couldn't form any new memories.
Okay. So his intelligence grew, but he could not remember things.
Right,
So like things that happened.
right.
Okay.
So he was forced to move back in with his parents, where he performed odd jobs, um, despite having to ask multiple times what it was that he was doing. It was later discovered that due to his loss of his hippocampus, really? You're just gonna took away his hippocampus, huh? Way to go. HM's brain began to understand time differently. According to Sam Keaton, 5 minutes lasted subjectively just 40 seconds for him, and an hour lasted 3 minutes. One day is 15 minutes. So he couldn't synchronize his times. He had no memory.
And
They took away his
he
hippocampus.
lived till 82,
And yep, he was
and
in
his
a,
time was that fast.
yeah.
So to him, he had to be almost like 300.
So interesting.
Like, like the time that passed, to
Right.
him, that had to be like crazy amount of years compared to what he actually lived.
Now he died from respiratory failure, which I always kind of laugh when people say that. Like, somebody died from respiratory failure. We're all gonna die from respiratory failure because you stop breathing. So, all right.
Mm, yeah.
But his brain was removed following his passing, and HM's brain was actually sliced or shaved into 2,401 slices, which is mounted on a glass plate and photographed at 20 times magnification to form a digital zoomable map down to the level of the individual neurons,
So his brain was studied to see what.
which is awesome.
So that is kind of wow.
That's awesome.
How thin they got that too to study that. Wow. So then there's this Ellen Lonesco, Lonesco,
Lonesco?
Lonesco. That
Lonesco?
sounds about
Yeah.
right.
Yeah, yeah.
Was reportedly the first person to receive a transorbital lobotomy.
Mm-hmm.
So that's
The
her
ice
fame.
pick.
That is her fame. She is the first transorbital. The surgery, and that is the ice pick, it describes the surgery, so we already did that. Prior to her surgery, she was described by her daughter as violently suicidal. Now, but after her lobotomy performed in 1946, the storm cloud seemed to evaporate. Um, and that phrase, like when you're going through a tough time
Mm-hmm.
and it just feels like there's a cloud over your head all the time,
Right.
just raining down on you.
Right.
That must be how she felt.
Mm-hmm.
Um, her mother described it was just peace. It was like a coin turning over. That quick, whatever he did something right. Although her personality might have been a bit more muted,
He was
which that
relieved.
makes me sad.
It does.
That makes me actually sad that her personality is muted. Um,
So she was relieved of her depression. Was she?
but was she? Because um, being a vet myself, I know with depression and PTSD, and I don't think you're ever really relieved of it. It's always a battle you fight. So I don't know that she was. I don't. That doesn't sound like if she became muted and didn't really say anything. That doesn't sound like she was relieved of it.
No, if your personality is muted, it makes me wonder what her personality was like afterwards. What do we mean by muted?
Yeah.
Should we do one more?
Yeah. Let's do one more. What are
Alrighty.
we at for time here? We're at about 25 minutes, so
Okay.
we can get one more in here. Anita McGee. Well, this is another Dr. Walter Freeman one.
Oh, Mr. Freeman.
Yes, Mr.
Alrighty.
Freeman, our favorite.
All right. So Dr. Freeman lobotomized this Anita McGee who was suffering from postpartum depression back in 1953. Unfortunately, how interesting does this sound? The procedure left her institutionalized for the rest of her life. Kind of sounds like a Rose Kennedy, don't you think?
Yes, it does.
Her daughter said, I previously think that something in Dr. Freeman wanted to be able to conquer people and take away who they were. That's a
I
little
think
scary.
well, you're taking away part of the brain, so I don't know. I don't know how he felt good about doing it, but that's okay. Um, that's
Oh,
oh, this is actually an interesting one. I think we should close with him. Dave
Rubenstein?
Rubenstein. Yes, actually, in 1980, there was a band, Reagan Youth, and it was a politically charged form of hardcore music that managed to toe the line between brilliant and kind of dumbed down circle pit anthems.
Okay,
Like your metal music, if you've ever gone to a hard rock concert or whatever.
right.
Um, so he had a bit of a nasty heroin habit.
The lead singer?
Yeah.
Okay.
And
He,
so
it sounds like he got into like a heroin addiction.
yeah, and it left him with head injury. So the doctors informed him that he required lobotomy in order to recover.
Okay.
So after the surgery, he technically did recover, but he was never again the same punk rock intellectual. I don't know if I would call it intellectual here, but
Maybe musically inclined.
yeah, he was not as intense as he was.
Okay.
So I think that's what they're more trying to say. Um, while he was fronting, as when he was fronting Reagan Youth. So
He actually quit singing. He left the
yeah,
band and
and
then put
then
himself directly into the lines of his addiction, like
yeah,
just threw himself into it.
so it did not cure his addiction at all.
It didn't
Um,
cure his addiction.
and the worst thing is he actually took his life after his girlfriend Tiffany Brischetti Briscanani
Brescanani, and who
was
was murdered by the serial killer of Joel
Joel Rifkin.
Rifkin, which is on my list of people I wanted to talk about.
Well,
So I love how that kind of throws it into there.
so next we're going to be doing Ed Gein, um,
Got to do a little spin off on Joel Rifkin
but Ed
because,
Gein is considered a serial killer, so we could continue our serial killer
sure,
with Joel Rifkin from that. That
absolutely,
actually that would actually work out really well.
absolutely.
So, um, well, this has been an episode of Paranormal Playground, production of Dead Squirrel in the Woods, uh, and we are your hosts, Nick and Leah. Make sure you click that subscribe button so you get new episodes when they come out. And thank you for listening.